The fading mind. For 62 years, David had a wonderful memory. He remembered names, dates, and stories perfectly. But over 3 weeks, everything changed. It started with small things. He would misplace his car keys or forget why he walked into a room. Soon, the fog got thicker. He would look at his wife, ask her a question, and then ask the exact same question just 2 minutes later. His mind was resetting itself every few moments. Then, things got scary. David started having strange episodes. He would suddenly look terrified for no reason, stare blankly into space, and smack his lips over and over. A few days later, these quiet moments turned into severe, full-body shaking seizures. His brain was experiencing electrical storms, and he was rushed to the hospital. Act 2. Looking for clues. The hospital doctors knew that the memory center of David's brain was under attack. They needed to find out why. First, they took an MRI scan of his brain. The scan showed a clear problem. The deep areas of his brain responsible for memory and emotion were bright, swollen, and inflamed. Next, the doctors did a spinal tap to collect a sample of the fluid surrounding his brain. When they looked under the microscope, they found a large number of white blood cells. This meant David's own immune system, which is supposed to fight off colds and infections, had mistakenly entered his brain and was causing inflammation. Act 3. A brain without breaks. The laboratory blood tests finally gave the doctors a specific name for David's illness: anti-Gaba B receptor encephalitis. To understand what this means, imagine the brain has two main pedals: a gas pedal to make thoughts and movements go, and a brake pedal to keep things calm and controlled. The Gaba B receptor is one of the brain's most important brake pedals. In David's body, the immune system had made a huge mistake. It created special proteins, called antibodies, that acted like a piece of wood jammed under his brain's brake pedal. How it works. These rogue proteins did not destroy the brain cells. They just sat tightly on top of the brake pedals, blocking them completely. Because the brain could no longer use its brakes, David's mind became overexcited, leading to severe confusion and constant seizures. Act 4. The hidden enemy. But the doctors had to ask one more question. Why did the immune system make this mistake in the first place? In older patients, this specific brain illness is almost always a warning sign for a hidden cancer. The doctors ordered a scan of David's chest to investigate. Deep inside his right lung, they found a tiny, aggressive tumor called small cell lung cancer. This tumor was the real mastermind. The tumor cells looked very similar to David's brain cells. When his immune system tried to fight the lung tumor, it got confused. The immune cells accidentally traveled to his brain and attacked his memory brakes instead. Amazingly, the brain illness happened before the lung cancer caused any breathing problems at all. The brain was ringing an alarm bell to save the body. Act 5. The journey back. Now that the doctors knew exactly what was wrong, they had a plan. They had to do two things at once: fight the lung cancer and calm down the angry immune system. David was given strong medicines to stop his immune system from attacking his brain, and he began treatment for his lung cancer. Because of the unique way this disease works, there was still high hope. Remember, the rogue proteins had only blocked the brain's brakes. They had not broken or destroyed them. Once the medicine started clearing those blockers away, the brake pedals began to work again. Slowly, the electrical storms in David's brain stopped. Weeks later, the heavy fog lifted. David sat up in his hospital bed, looked at his wife and smiled. He could remember what happened yesterday, and he could remember her name. By finding the hidden tumor through his brain's alarm bell, the doctors were able to save both his mind and his life.